Eczema herpeticum is not a very common kind of disease related to the skin. This is caused by a virus called herpes simplex. There's not a strong determinant of age or gender that are more susceptible to this kind of illness. It can be passing but could also be around for up to 6 more weeks. Prolonged exposure and delayed treatment may leave some scars. Eczema herpeticum is a viral infection. The person having it will see tiny blisters arranged in clusters. Fever may be experienced as its generalized weakness. It will not necessarily spread all throughout the body, but it is localized, but in some cases, it will develop all over to the extent that blisters will completely cover the body. If not given early treatment, eczema herpeticum may grow to bigger vesicles containing pus, causing it to be crusty and prone to bleeding. Even though it will disappear in due time, all conditions except the very mild ones are considered an emergency since the person is at risk of having a superinfection. Superinfection is always a possibility when it comes to eczema herpeticum. Open wounds from vesicles that had bled could be fresh portal of entry for bacteria and virus to cause another infection. Treatment would be very challenging if the generation of bacteria and virus that entered the body have resistant strains. Acyclovir is a famous drug commonly used to cure eczema herpeticus and its underlying problems. Pus-filled vesicles that are umbilicated are the usual appearance of eczema herpeticum. Due to its severe complications, the doctor might order some tests in order to determine what actions to take so that the disease will be managed before it's too late. One of these tests would be viral cultures of fluid taken from the blisters. A biopsy will also be done with the skin as the sample. Treatment for eczema herpeticum is usually delayed due to the suspicion of other skin conditions. All of those had to be ruled out before actual diagnosis is given and a proper treatment plan can be started. Since eczema herpeticum may spread to the entire body, it can also reach the eyes, leaving it scarred. This causes blindness. Though it is a localized form of disease, it has a tendency to become a systemic infection and may affect internal organs. When it reaches this point, the person becomes septic. A stronger treatment plan is needed since it may claim the life of the patient.